Hi guys, this YouTube video covers Chapter 18, which is the biopsychology of psychiatric disorders, and we're going to be talking about schizophrenia today. So schizophrenia is a psychiatric disorder that can include several different brain diseases. There are different types of symptoms, both positive and negative. Positive symptoms include delusions, for instance, thoughts of being controlled, persecuted, or thoughts of grandeur. They may suffer from hallucinations like hearing voices, inappropriate affect, illogical speech and or thought, and odd behavior. Negative symptoms include a reduction or complete absence of emotional expression, speech, motivation, and an inability to experience joy and pleasure. A person is likely to be diagnosed with schizophrenia if they have experienced any two of these symptoms for a period of 1 month or longer. But if they experience hallucinations or delusions for 1 month, they really don't need any other symptoms in order to be diagnosed.
Hey guys, I'm going to give you some facts about schizophrenia. It's the splitting of the psychic functioning, which refers to the breakdown of integration of emotion, thought, and action. It affects 1% of the population, and it's a diverse disorder with multiple types which exists with varied profiles.
Some causal factors in schizophrenia. There is evidence for a genetic contribution, and there is multiple causes and several different chromosomes implicated. Also associated with various early insults, infections, autoimmune reactions, toxins, traumatic injury, and stress. It also appears that interference with the normal development of subspecial individuals may lead to the development of the disorder.
Hello, I'm going to be talking about the treatment for schizophrenia. First I'm going to be talking about chlorpromazine. It calms agitated and activates blunt schizophrenia. And reciprine is also found to be effective, but it's no longer used. And the first step of what the drugs actually do neurologically is it starts off in blocking the postsynaptic receptor sites, and then it blocks the ability of dopamine, and then number two, it blocks it, and then it sends presynaptic neurons to increase dopamine on those receptor sites.
So the study is called Reading Impairments in Schizophrenia Relate to Individual Differences in Phonological Processing and Oculomotor Control. Language and oculomotor disturbances are two of the best replicated findings in schizophrenia. However, few have examined the contribution of cognitive and motor processes and underlying reading performance. To evaluate the relationship between linguistic processes and oculomotor control, 20 individuals with schizophrenia and 16 demographically matched controls were tested using a moving window paradigm. Using the comprehensive test of phonological processing, eye movements were assessed during reading and during non-linguistic tests. In results, compared with controlled schizophrenia patients exhibited robust oculomotor markers of reading difficulty and were less affected by reductions in window size, indicating reduced perceptual span.